is a vibrant 5-year-old boy. It's the night before the new school's term starts, and Andrew, who's known with asthma, is wheezing and incredibly ill. Andrew sits on Mom's lap, and Mom and Dad give him his inhaler, and within no time, Andrew settles down and feels more comfortable. Tembi is a 5-year-old girl, and she is a new student to Little Lambs Pre-Primary School, which is the same school attended by Andrew. It is her first day at school, and Tembi is quite nervous and shy, sort of like how I'm feeling now. And she is nervous about her first day at school. So imagine her surprise when Andrew comes up to her and he takes her hand and he leads her to the playground and he introduces her to all his new friends. Tembi is now at ease and she feels more comfortable and she's ready to start her new school term. So during their lunch break, Andrew decides to share his lunch with Tembi. He decides, let's swap sandwiches, because this is how kids show each other that they have little crushes. And this is before Instagram and all these other things. So they swap sandwiches, and about 15 minutes later, Tembi starts to feel a bit uncomfortable. Her face starts to swell up, her eyes become quite puffy, and her breathing changes. Andrew notices this because he remembers that he felt the same way the night before. It'll pass in a minute, he thinks. So he sits down with Tembi and he rubs her back the same way Mom had rubbed his back the night before. What Andrew forgot was it was his inhaler that had made him feel better and not Mom rubbing his back. It's only when Tembi falls over that Andrew starts to panic and scream and draws the attention of Miss Naidu, who's the teacher who's been tasked to look after them. She rushes over and realizes that this is quite a serious situation, so she takes charge. Help! She has no idea what to do. It's her first day at school also, and she's a young teacher. She calls over one of the other teachers who comes and helps her. Where's Tembi's health information chart? I don't know where it's kept. What do we tell the paramedics when we call them? I don't know. What do we do? I don't know. It's only when the paramedics arrive that Tembi is lying still on the ground, and it's too late to intervene. They call time of death at 9:45. Tembi, as you can surmise, had a severe allergic reaction to the peanut butter sandwich that she was given by her new friend. Tembi's parents knew that Tembi was allergic to peanuts and had actually informed the school, but the school had not informed the teachers on how to manage Tembi if something were to happen to her. Likewise, Andrew knew that he was not meant to share any food, and his parents also knew that the school had a very strict no-nut policy. But for some reason, Mom thought my child wasn't feeling well the night before, I'm going to make him his favorite sandwiches to take to school. An innocent mistake that cost someone their life. Imagine being Tembi's parents and receiving a call that day that your child will not be coming home. Imagine being Andrew and realizing that you're the reason that your friend won't be coming to school tomorrow because of an innocent mistake that you had made. Imagine being the teachers at the school and realizing that you were helpless, and if you'd actually known what to do or taken action, you could have saved a child's life that was entrusted to you. I want this all to sink in with you as I share my background with you and my solution to this problem. So my name is Rufaro Nyamuda, and I took an oath to become a medical doctor in 2012. I solemnly declare that I will exercise my profession to the best of my knowledge and ability for the safety and welfare of those entrusted to my care, and also for the health and well-being of those in the community. And children make up a large number of people in our community. What if I were to tell you that the schools that we send our children to are actually one of the largest untapped healthcare delivery systems in our world? Here in South Africa, a very heavily under-resourced setting, where they're tasked to look after 19.6 million children and adolescents under the age of 18. And this number is growing. This makes up about 35% of our population. What if Tembi's and Andrew's school had had better resources? What if they'd educated the staff members on what to do? What if they'd educated Andrew on what to do if one of the children on the playground were in trouble? But the reality is that most schools in our country aren't able to provide these resources. Things are costly. It's expensive to send them to first aid training courses, and they're helpless. We haven't given them any solutions as to what to do. The number of children who are presenting with chronic conditions is increasing, and the number of children who are taking serious medication on a daily basis is increasing. Without adequate insight into the health needs of their learners at schools, we're leaving schools at quite a high risk. If teachers aren't able to go on these first aid training courses and schools aren't able to employ full-time nurses or full-time staff to look after them, who are we entrusting the care of our children to? The hockey coach? The secretary? The maths teacher? Because that's essentially what the situation is right now. Teachers, we've created this false sense of security where we say to parents, yes, some of our staff members are first aid trained, but if you have a high percentage of children in your school who are asthmatic or diabetic and epileptic, and yes, you send your teacher to a first aid training course where they learn CPR, is it really helpful for your school? If we go back to our example of Andrew and Tundi, the first responder was a child. The second responder was a teacher, an adult, who still didn't know what to do. I have a problem with the way that we're approaching emergency care in our country. Firstly, I think it's incredibly costly, and that's a massive barrier for a lot of schools. Second, I feel that information is easily forgotten. You cram in so much information into a few hours, and we expect people to remember this. As a trained healthcare professional, I know how difficult it is to remember all of these things. Every time I'm tasked with an emergency, my heart skips a beat. And then I know that all the work that I'd been trained for so many years kicks in. I cannot imagine a teacher who has no healthcare training and now who's tasked with looking after children with no resources or help. And that's exactly the situation that we've created. I've had the opportunity of working in both public and private sector. In the public sector, I've worked at hospitals like Chris Hani Baragwanath Academic Hospital in Soweto, which is known internationally for its vast range of casualties. Barra, as it's affectionately known, is the 4th largest hospital in the world and the largest in Africa. The pediatric unit is incredibly busy, and I've had an opportunity to care for and treat a large number of low-income families in our country. I've also worked in private practice as a GP and as an emergency department doctor, and I've seen some of the wealthiest people in our country. And what I've found is that although different people spend different amounts in healthcare, their children still present with the same conditions: burns, allergies, diabetes, seizure disorders, and our approach to them as doctors is exactly the same. So I know that the example of Andrew and Tembi can be applied to any social economic group, and it's not just specific to one. Our schools are in great need of help. And HELP is my algorithm for health education learning platform. So my solution and my vision was to create an organization and technology that would allow us to promote healthy, safe schools. We teach children from as young as 5 basic first aid skills. So by the time that they're in grade 7, they'll have a level 1 first aid certificate, which is my vision for the country, that every single child in our country would have a level 1 first aid certificate. Because the wonderful thing about children is they go home and they love to teach people. So we encourage them to show mommy how to do this, and you get a reward for this. Show granny how to cross the road, and you get a reward for this. So we're empowering the next generation that they know how to take action when someone might be in trouble or need help. KeepSafe also provides a platform for educators and staff and parents to access vital information so they too can become quite learned and read up on things that might concern them. We provide schools insight into chronic health management to preventative care and a structured e-learning platform that we actually teach them basic first aid skills also, with the idea that we're going to increase the number of staff members from 2 or 3 to 100% of the staff members who will be first aid trained through our online platform. So if we rewind and we go back to our story in the beginning, let's imagine for a minute that Andrew had gone through the KeepSafe program. She takes a bite of the sandwich, and within a few minutes, her face starts to swell and becomes incredibly puffy, and her breathing labored. Andrew, who's only 5 years old, but has gone through the KeepSafe program, has the confidence enough to know that something is wrong. He stays with her, but he alerts another child to go and call Miss Naidu. Miss Naidu, although she's a new teacher to the school and hasn't gone through any training, is provided with all of Tembi's health information immediately. So she knows how to take action, as there would have been a health plan that would have been discussed with the parents, with the healthcare provider, and with the school. So should Tembi be in trouble, they wouldn't have to go and search for a health form somewhere. They would have it with them immediately. An empowered generation becomes an empowering generation. And we know that the story for Tembi and Andrew doesn't end there. They will become adults, and they'll know that there's importance for them to pass this on to their children. I encourage you as members of the audience, some of you who might be parents, I want to challenge you and ask you, what is it that you are doing to increase knowledge that our children have when it comes to keeping themselves and others safe? I want to ask you what you are doing. Are you going on courses? Are you keeping up to breath with learning? Because at any moment an emergency could happen. And what I want for people who are going through this course is that the next generation would have a group of adults who are not only competent but confident enough to take action when need be. Imagine that we could be educating that 19.6 million children in our country to take action when someone is in trouble. Years from now, Andrew and Tembi are able to look back at that day with a smile on their face because they know that Andrew was able to save Tembi's life. This is not just education for children, but this is education for life. Thank you very much.